Lovely to be here today. Thank you for the invitation. I'm Isobel Jones from Welsh Ambulance Service Patient Experience and Community Involvement Team, and I'm going to take you through a whistle-stop journey since 2016. So basically, is it possible that I can have my PowerPoint now, please, on the screen? There we go. So this is the journey of our Welsh Ambulance Service mental health helpline leaflet. It's basically a bilingual leaflet which has got all the main helplines at a glance. And this wonderful leaflet I can't take a lot of credit for, to be honest with you, because I work very closely in partnership with WAST and Interlink from Pontypridd and Rhondda Cynon Taf and Merthyr Tydfil, and they're wonderful service user representatives, and to be honest with you, it would not have happened without their very in-depth involvement. But the journey began in 2016 when the Welsh Ambulance Service asked me to very kindly visit community groups completely all over Wales and talk to people with lived experience of mental health, which I absolutely love doing. And this led to me doing a paper which my manager asked me to present at the Welsh Ambulance Trust Board. Now, normally it's not somebody at my level that would present, but Leanne said, my manager said, Isobel, you are the one who spoke to people. You are the one who needs to tell the Trust Board what the voices of the people are saying. So I did. During that year, between 2016 and 2017, I also joined the local mental health forum in Rhondda Cynon Taf, which is where my patch is. And I was heavily involved with the forum during that time and did a lot of local consultation with people with lived experience in various community groups across Rhondda Cynon Taf and Merthyr Tydfil. And so basically, by 2018, end of 2018, 2019, we were forming an action plan for the following year. But during that year also, I did a more localised consultation on the Welsh Ambulance Service local pathways for mental health. So there was a number of things happening on a local and national level, but at the same time, what I was getting is the voices of the people, and people were telling me these things, and in my mind there were a number of themes coming up from the initial consultation. So it went then from consultation to involvement, and involvement in the forum and involvement with people with lived experience then in planning the year ahead for the forum. And I had to bring up about the local consultation that we'd done regarding the mental health pathway for Welsh Ambulance Service. And there were two quotes which, as far as this actual leaflet concerned, are definitely the Achilles heel, the key quotes that were used that really spoke to me, that really kind of drove me in this discussion around the plan. One of which was, Welsh Ambulance Service crews don't have much knowledge of local services. Can this be improved? It would be really helpful. And the other quote was basically saying, it would be really good if Welsh Ambulance Service crews knew more about the community groups that are available locally so that people can be signposted to them. Because the big themes that were coming out through these visits to community groups across Wales and locally was that certain things were not working very well in an emergency. For example, if somebody went into crisis, they were saying it didn't work very well for them if they ended up in A&E. And they really thought it would be helpful if there could be more knowledge of local services. So I brought this around the table, and as I say, there were people with all different backgrounds around the table in the forum, including people with lived experience in mental health. And the idea then gave birth to the idea of having a mental health helplines leaflet, and it all came from that discussion. So a task group was set up in January 2019. The first task group met, including people from the Interlink, BAMT and the service user representatives were very much at the forefront of those discussions. Through that year, they designed the leaflet basically. I was there chairing the meetings and taking notes, but every idea, every helpline, every way that this leaflet is laid out, all the comments that are there in it about the different helplines were decisions made fully with that group. And as I say, I can take very little credit for that. For example, the layout in the front of the leaflet gives 3 main headlines, 3 main go-to places, and then inside it goes through 23 others. And the 3 criteria that we used, which were brought up by people who themselves thought this was really important, there needed to be telephone helplines, where possible 24/7 availability, where possible free, and where possible Wales-wide. So those were the criteria, and everything in that leaflet was basically as a result of the discussions with our wonderful service user representatives from those forums. So I took this, this raised a question then, well, should it really be a local leaflet then, if it's got all the national helplines in it? So I approached my managers and I was given 100% support for funding, because we funded the leaflet for a Wales-wide. So what started off as a very, very local initiative suddenly became embraced worldwide. And later on, because the police also felt that there was such a need for this in their service, they then rebranded the same leaflet in blue, basically, for the police as well. So what started off as a very small local initiative very quickly became a national initiative, and not only for the Welsh Ambulance Service in green, but for the police in blue as well. So we were really, really excited about that. That was celebrated with the forum in their annual review in the middle of 2019. And basically, you know, the leaflet went live in August 2019. It was printed and it was in every ambulance station across Wales by the middle of August 2019. And it was also available for community groups, whoever asked. It's available online and it's available as a paper copy. So then we planned the launch of the leaflet. Again, the same group, the same task group, and every idea for the launch came from service user representation. As I say, I can't take very much credit for the way the launch happened. The cake was purchased. I had the ideas about the flags on the cake with the logos from all the different organisations who were mentioned on the leaflet, the full endorsement of those. Every single aspect of the launch event was very much what the service users representation, the people with lived experience, what they suggested. And it all happened on World Mental Health Day in 2019 in Nantgarw College. We were so thrilled to see the leaflet launched, and it's been a great success. And across all the agencies, everyone has said how helpful it is, how important it is to have everything at a glance. And, you know, as a result of the wider consultation, this small thing happened, this small leaflet, which has had a big impact. But as a result of the wider consultation across Wales, the Welsh Ambulance Service now have a mental health team that came out of that mental health improvement plan. We have a mental health lead who initiates on this, and many, many themes that came out of the feedback are now actually happening. So, for example, the training for paramedics, etc., in mental health. There is now there are now trained professionals at the point of the 999 call who assist with the 999 call where there is a mental health need. All these changes have happened because of service user involvement through that that Wales-wide consultation, feeding those ideas and thoughts in, bringing it then into more of a involvement, and then into the co-production of one specific area, this leaflet. And we're so thankful to have had the privilege of being involved in this journey, and really, really can't endorse more the importance of the co-production aspects of it, because this is one small example within the Welsh Ambulance Service of mental health co-production, but we have similar examples in learning disability, LGBT, ethnic minority groups, etc., people with sensory loss. So we're very, very privileged to be able to work in partnership around the table with so many wonderful people who help shape our service into the future. So thank you for listening, and if you have any questions, please go ahead.